If you could only work 2 muscles at all for most of your clients, my 2 would be SCM and scalenes. In this other video here, we talk about SCM and we give a few different stretches, especially for the second head. Now we're going to go through and show some techniques to work and help the scalenes release, which is going to make your neck pain, jaw pain, headache clients, shoulder pain clients, it's going to make all of them a lot happier. So let's get to it. A lot of therapists are really uncomfortable working on the anterior neck, but I have to tell you, if I could only do one thing for most of my clients, it would be this. If I could just spend 5 minutes working on the anterior neck muscles, that's going to go a whole long way towards relieving a lot of their symptoms, especially in the modern day with all the devices that we're using and all of the head forward posture that we're seeing. In this video, we're going to go through a couple different easy to learn release techniques for the scalenes. So first, a little bit of landmarking, right? If I lift their head and turn, I want to find their SCM muscle first. The scalenes are all going to be lateral, and there are 7 on each side for most people. Some people have 6. So everything is going to be lateral to the SCM, so you want to make sure that you're landmarking by that, right? And now, here it is. I've got that. The first thing we're going to learn is just a pin and stretch technique, where we're going to hold the attachment points down on the first and second ribs gently and rock the head from left to right. So the first scalene we're going to look for is going to be just lateral to the SCM. And you're looking for the feeling of a ropey muscle. It's going to be very thin and very tight. And once you find that, you can gently press down, not down that way, but down towards the feet. We're trying to go right behind the clavicle. And you don't want to use a lot of pressure here. Like, I'm using about that much pressure, and I'm guessing that probably feels like at least a 4 or a 5. Maybe not. And once I've got contact to the muscle on my left hand, my right hand is going to rock the head gently side to side, which is going to allow the muscle to pin and stretch. And a little bit goes a long way. So now I'm going to work laterally from there until I find the next little ropey thing that feels like a muscle. That's going to be a scalene as well. And again, I can try to contact its attachment on the first rib. I might not get all the way back there, and that's okay. As long as I'm in the right place behind, then I'm going to come laterally and work towards the third stringy muscle. And then I'm going to keep working my way laterally, making sure that I'm contacting something that feels ropey. And there are roughly 7 on each side. You may not get to feel each and every one of them, but that's okay. Now, a couple things to keep in mind here. As long as you feel a ropey muscle, you're going to be safe. If you're in between those places, there are a couple things that you need to watch out for. There's the main artery to your brain on each side. If you feel a pulse in there and you press into that and the pulse disappears, that's bad. If you're pressing into a muscle and you feel a pulse next to your finger, as long as the pulse is still going, that's safe. Anything that feels really nervy in there, you should avoid, and you just want to make sure that you're paying attention to what your clients are feeling, what their face is looking like. But the main thing for safety is that if you're feeling a ropey muscle, you're in the right place. So here I've got the SCM, and now I'm going to go a little lateral to that. Find the first rope. And then moving lateral to that. Find the second rope. And gently working my way laterally. I could spend more time in here if I felt like they were really tight, or less depending on the client. But honestly, a little bit goes a long way in all of these. It's not going to take a ton of pressure. And you definitely want to check in with your client, because your feeling of what normal pressure is would probably produce the feeling of an 8 or a 9 for them. And so you want to sink in at what you think of as light pressure, and then check in, what is that on a scale of 1 to 10? And you know, if they tell you it's a 2, then yes, you can add more pressure. But I think you'll be surprised at how many times you'll think you're giving a 2 on the pressure scale, and they'll tell you it's a 5 or a 6. Okay, so that's the first and the technique I use the most often. Almost nobody gets off my table in the middle of a 60-minute session without that much work on their scalenes. It's pretty rare. But let's say I had somebody who really just didn't release, or just stayed super tight, or I had worked on them that way one session and they came back and everything just still felt completely unwilling to let go. There's a next level up of an active release for this that I use. And so what I'm going to want you to do is I'm going to contact the muscles the same way, but instead of me rocking your head, you're going to slowly rotate away from the muscle. So first I'm going to contact, I'm going to find that attachment point here. So now slowly rotate your head away, try not to roll it, but actually just rotate the spine, and try not to lift backwards with the suboccipitals either. Keep rolling, rolling, rolling. You're in charge of the stretch. And then when you get about as far as you think you want to go, slowly come back to center. Great. And now I'm going to come over here, have you slowly roll out again. And come back. And again. And back. Great. Now I could work all through those one by one, and I recommend that you do that, but I'm going to come around and just balance out the other side. Slowly turn to the left now. Yeah, this side's harder, huh? Now, one trick when you find that one side is harder than the other is to prompt them to try and fire the scalenes on your left and let go of the ones on your right. Yeah, good. And come back again. Sometimes when the scalenes are tight on one side, we just really we've lost the ability to let go of the side that isn't working. And go ahead and turn away to the left, so you're letting go of the scalenes on the right, but firing the ones on the left. Come back. Let's do one more. Come back. I'm gonna do one more on this side because this one's really tight. Try to let go of the one under my thumb and fire the ones on the left. The left side's the one that's turning you. The right side's releasing. And when you come back, the opposite's happening. And come back. Nice. Now, one last technique we can do here is turn the head. And I wouldn't do this with the anterior scalenes that are really close to the middle of the neck because there's just too much stuff in there like veins, nerves, etc. and arteries that you want to watch out for. But these lateral scalenes that are right next to the traps really are pretty safe to work on this way. So right above the traps, I can fascially work up the lateral scalenes towards, towards the vertebra. I should have finished that sentence. And come back. I'm gonna do this. And so again, I'm just above the traps, but not so far in that I'm worrying about any really delicate and dangerous structures. And I'm going to fascially work up, and I'm really trying to promote the nervous system's ability to turn the head even more towards the left, and you should see the head turning more towards the left in response to the stroke. Nice. And whenever I work on the anterior neck, I always just want to do a very gentle figure 8 kind of motion with the neck to have the client realize that they've gained a lot more range of motion. So that I'm not gripping the head and turning it, I'm resting it in my hands and letting gravity fall to the left, and then fall to the right, and then fall to the left. And for a lot of clients who, especially ones with neck pain where they're just not used to being able to turn their head or they're very restricted, that's going to be like this so great aha moment for them and just like make it all worth all the stuff that you did on them. Their brain is going to go, oh my God, I can turn my neck, and that's great. Cool. There you have it. Some really easy to learn techniques to help you release your client's scalene muscles, which is really going to help their neck pain, jaw pain, headache pain, etc. If you like this video, please hit the subscribe button below for future updates, and we really think you're going to like this video too.